Oral, MDI, and vaginal suppository checkoff medication administration. Review MAR for the 5 rights.
I have Charlotte Fox. She will be getting low pressure, 50 milligrams, oral, daily at 8 a.m. She's also going to get albuterol, MDI, 90 micrograms per inhalation, 2 puffs daily at 8 a.m. for Charlotte Fox. And also for Charlotte Fox, she will be getting Monostat, 1,200 milligrams, ovule vaginally daily at 8 a.m.
Verify allergies.
Charlotte has no known allergies.
Research information about each medication. Gather equipment, gloves, correct medication, medication cup, glass of water, and straw. Perform hand hygiene. Calculate and correctly prepare accurate dosage of each medication to be administered.
Okay, my first medicine for Charlotte Fox is low pressure, 50 milligrams. I have low pressure, 100 milligrams. Orally, I have a tablet. It's going to be given daily at 8 a.m. Then I have Charlotte Fox. I'm going to give albuterol. I have albuterol. It's an MDI, 90 micrograms per inhalation, 90 micrograms per inhalation. She will be doing 2 puffs daily at 8 a.m. And then for Charlotte Fox, I have Charlotte Fox. I'm going to be giving Monostat. I have Monostat, 1,200 milligrams, ovule vaginally daily at 8 a.m. That was my first check. On my second check, I have to do a calculation for the low pressure. I have 100 milligrams, I'm going to give 50, so I'm going to go ahead and cut this tablet in half. Okay, so I have Charlotte Fox, low pressure, 50 milligrams. I have a 100 milligram tablet, so I cut it in half, and I have half in my cup. Oral, it's tablet daily at 8 a.m. I'm going to give that at 8 a.m. I'm going to leave that in there so I can verify with my third check. And I threw my other half away. My second check on Charlotte Fox, I have albuterol, MDI, 90 micrograms per inhalation, MDI, 90 micrograms per inhalation. I will be giving 2 puffs daily, at 8 a.m. Then I have Charlotte Fox, Monostat. I have Monostat, 1,200 milligrams, ovule vaginally daily, and I'm giving this at 8 a.m.
Oral medication administration. Perform hand hygiene. Introduce self and identify patient by 2 patient identifiers: name, date of birth, medical record number.
Hi, my name is Cheryl. I'm going to be taking care of you today. Can you verify your name and birth date for me?
Charlotte Fox 000000.
And that coincides with my MAR.
Provide for privacy. Conduct any necessary pre-administration assessment.
Charlotte, since I have your blood pressure met, I'm going to go ahead and check your blood pressure. Make sure it's okay to give. And you're 130/90, so we're going to go ahead and give that medicine.
Explain the purpose of each medication to the patient.
We're going to give you your blood pressure medicine to help keep that in the normal range, and then I have your inhaler to help your lungs, and also your Monostat for your infection.
Position the patient correctly for oral medication to be swallowed.
I'm going to raise you up here. And before I give you your meds, I'm going to do my my third check. Make sure we're ready to go. So I already verified your Charlotte Fox. I have low pressure, 50 milligrams. I had 100 milligram tab, so I cut it in half. It's orally, I have a tablet, it's due at 8 o'clock. It's 8 o'clock. And then I have Charlotte Fox. We're gonna give albuterol. I have albuterol, MDI, 90 micrograms per inhalation. MDI, 90 micrograms per inhalation. I'll be giving you 2 puffs at 8 o'clock, 2 puffs at 8 o'clock. And then I also have your monostat, antifungal, it's 1200 milligrams, ovule, vaginally, daily at 8 a.m.
Administer medication as per patient's tolerance.
Okay, I'm gonna go ahead and give you your oral pill. So if you can go ahead and swallow this, take a drink.
Remain with client until oral medications are swallowed. MDI administration. Assess the patient lungs prior to the medication administration.
I'm gonna go ahead and just pull this down for a second.
Remove the mouthpiece cover from the MDI and the spacer and attach the MDI to the spacer. Shake the inhaler well. Have the patient place the spacer's mouthpiece into their mouth and grasp securely with teeth and lips. Have the patient depress the canister, releasing 1 puff into the spacer, then have the patient inhale slowly and deeply through the mouth. Instruct the patient to hold their breath for 5 to 10 seconds or as long as possible, and then to exhale slowly through pursed lips. Wait 1 to 5 minutes as prescribed before administering the next puff if ordered. Reassess lung sounds, oxygen saturation, and respirations when complete.
Here's your second one. Second one made a big difference.
Vaginal suppository administration. Don clean gloves. Place the drug in the applicator. Lubricate the applicator tip with a water-soluble lubricant. Position the client supine with knees bent and abducted. Separate the labia with non-dominant hand and insert the applicator into the vagina, usually 2 to 4 inches. Instill medication by pushing the plunger. Remove the applicator and properly dispose of. Offer a sanitary pad. Have the patient remain in the recumbent position for at least 10 to 30 minutes. Reposition patient for comfort as needed and maintain a safe environment. Remove gloves and perform hand hygiene. Record all medications administered per facility policy, including pre-administration assessment data. Evaluate patient's response to the medication within an appropriate time frame and document per facility policy. Maintain proper body mechanics throughout the procedure and maintain patient safety during the procedure.